Hi, everybody. Biohacking Blondes here. We're very excited today. We have Dr. Joseph Purita here.
Right.
Doctor, there he is. We're so excited, and he just got out of surgery, so we're so thrilled that he's here. um, so Dr. Purita is a pioneer in regenerative cell and PRP therapy for orthopedic conditions. He graduated from Georgetown University Medical School and completed his surgical training at the University of Florida Medical Center and the University of Miami-Jackson Memorial Hospital, where he was chief administrative resident. After joining the Boca Raton Orthopedic Group in 1981, he became an instructor for surgeons in laser use for orthopedic surgery. Now he is the medical director of the fabulous PUR-FORM in Boca Raton, which Alex has been to, where he leads a facility dedicated to cutting-edge regenerative medicine, anti-aging techniques, biohacking devices, and evidence-based health optimization. Welcome, Dr. Purita. We're so excited to have you.
You, it's an
Welcome.
honor for me to be with you guys.
Great. How did you guys meet? You guys met at his place, right?
Well, so I decided one day to drive down to see Dr. Purita, kind of without him knowing. I barged into his office because Dr. Purita and I are actually, believe it or not, on the same board of Demarest Stem Cell Clinic. So I am the biohacker advisor, and Dr. Purita is the stem cell, one of their advisors there. And I decided that I need to meet him.
Small
So
world.
I barged into his office and was incredibly thrilled with the offerings that he has. It's a candy land for someone like Molly and me that loves biohacking and all the modalities. And he's got the newest, best stacks. And he is just an incredible, knowledgeable man in this space. So, Dr. Purita, welcome. And let's,
And my pleasure.
let us ask you how did this how did you get started in this space? Tell us about you.
I've always been intrigued by the cutting edge. When I was a resident, I was intrigued. I was actually doing some things on discs where we were using essentially chymopapane, which is Adolph's meat tenderizer, more or less, for herniated disc to dissolve it. And we were having very good results. And I said, fine. And then, I was doing orthopedics. I finished my residency and I was doing joint replacements and just kept saying, boy, this is kind of a, pretty brutal surgery when all is said and done. And then one day I kind of read an article about something called PRP, platelet-rich plasma. I said, all right, man, let me try it. So I started using it and I said, wow, my patients seem to be doing better with this. So I put some of the platelets in the wound, and then I would spray some other things, which we call platelet poor plasma, on the wound itself, and they did better. And I said, I got to check this out further. And then I started saying, hey, I think I'm going to use this because this is really what nature does. This is how nature heals things. And then, I have a slide that I have in one of my talks. And this is a very profound slide. And it really sums up everything that we do. Cells, not doctors, heal patients. You could be doing a hip replacement, knee replacement, open heart surgery, whatever. Eventually, your cells have to heal things. So as a physician, what I really am trying to do is to direct the cells to do the job. And, the healing powers are within our body if we know how to unlock them and make them work to our advantage. Simple as that. I mean, when all is said and done, and I have another kind of term that I like to do too. One thing we're not here is a med spa. We're a med wellness facility. And I like the people to think of something like this. Your body, your organs and your cells are the computer hardware. The pathways in your body are the software. Now, when you have a problem with your computer, what's your first thing? You say, let me just see if I can reboot it. And that's what we're trying to do. We're trying to reboot some of these pathways that have not been functioning properly. And that's kind of the essence of what we do. We kind of tinker with the pathways, and we use the premise, cells, not doctors, heal patients.
I
I
love
love
that.
that.
Yeah.
Yeah, it's phenomenal. And can you tell us some of the different therapies that you're using at your clinic? So I know V cells, stem cells.
Okay, well, let's talk about them. Okay, so let's talk about a V cell first. Now, the name V cell means very small embryonic-like stem cell. Now, first of all, when you hear the word embryonic, you start saying, oh my God, embryos, oh, they're killing babies. No, it has nothing to do. These are cells that are found in your own body. Now, the interesting thing about these cells, they are like embryonic cells, and they have a very wide potential for regenerative procedures. Now, these cells are sort of an emergency stem cell supply in the body. They get activated by a very different stress of some type or other. Let's say, God forbid, you're in an accident, you lose a lot of your blood supply, the body kind of puts them in motion to be activated. So how do we activate them? Well, we basically take them out from your blood. We then put them after we process them, we put them at 4 degrees centigrade overnight in low oxygen conditions. So what does that tell you? 4 degrees centigrade is about 38, 39 degrees. That's stressful to a cell. And low oxygen is also stressful to the cell. So now we've taken a cell that is kind of what we call quiescent in the world of biologics, meaning it's asleep, but it has the potential, given the right circumstances, to awaken and do a lot of different things. It's in hibernation, so to speak. So we awaken them, and then we give them back intravenously. Now, these cells are very small, so they can get in a lot of little nooks and crannies in the body. They can penetrate the blood-brain barrier, et cetera, and do a lot of interesting things. So that's one type of cellular therapy that we do. And interesting, how do we do that? Well, we give the patients ahead of time, and then we'll reveal some of our secrets, and some of them we won't, so to speak. But we give people something called fucoidan, which is if you look it up online, you'll see it's a seaweed, and it's interesting. It's found near many of the blue zones. For instance, it's very, very much in the diet of the people from Okinawa. What do we know about the people from Okinawa? Very long-lived. So we know that this stimulates the bone marrow to release more of these cells into the circulation. What else do we do? Well, we have something called a platelet lysate. What does that mean in regular everyday English? Well, a platelet lysate is when we go ahead and get your platelets, we concentrate them, but then we kind of crack them open to release all the growth factors. And we kind of mix it with that kind of a milieu, kind of a soup that we mix the cells with. And that's how we culture them overnight, so to speak.
Wow, absolutely incredible. And what type of kind of candidates would come in for these type of treatments, let's say?
Well, it depends. Now, our realm of patients runs the whole spectrum of things, from people who are super athletes or professional athletes to people who have autoimmune conditions, to people who have long COVID. You name it, we can basically take care of it. Now, there's certain things we're not going to really kind of make much of a dent in. I mean, we kind of shy away from cancers because I'm just not sure. And I'll do some of those patients, but only at the blessing of their oncologist. I mean, I just don't want to put a target on my back. I know that a lot of our modalities can do some really good things, but again, I want to kind of, work in unison with other physicians on that. They're physicians.
So for someone that has Hashimoto's, like myself, what would you do with someone like me that has a thyroid that has been chewed up, basically?
Right. So basically a couple of things. We know Hashimoto's is an autoimmune condition. Okay. The causes, who knows for sure. I myself have one idea that some of it may be viral in origin. And so one of the things that I would recommend is something called an EBO2. Now, what does that mean in everyday English? Even when I tell you that, you're still going to say, what does that mean? Extracorporeal blood oxygenation and ozonation. But what does that mean in real English? Well, anything that's extracorporeal means it's outside the body. So kind of use your imagination. We have one IV line leaving an arm. Now the blood is being pulled by a pump. It's literally being pumped out of the vein. It's then going into a dialysis filter, where it's now mixing magically with ozone gas. Now, remember, ozone is quite toxic. In this procedure, no ozone ever enters the body, because when ozone mixes with the blood, it forms a couple of interesting compounds. One thing is called a lipid oxidation product. And another thing, believe it or not, is something called hydrogen peroxide, which we've heard about. But those two compounds can start affecting the immune system. We know that the most potent stimulator of the immune system is actually hydrogen peroxide. So what those things do is they start causing some oxidative stress in the body. And you say, well, wait a minute, isn't oxidative stress something bad? Well, yes, it is. In the right circumstances, it actually is very beneficial, because there's something in the world of biologics called the hormesis effect, meaning a certain concentration of something is very beneficial. Too little, probably not going to do anything. Too much, it's going to be toxic. Now, and this is, This applies to most everything. This is for your blood sugar. If your blood sugar is too low, you'll basically die. If it's too high, you can basically die. But when it's that level of around, 85 or so, it's great. Same thing with oxygen. So everything has this effect. And when you have a certain, sweet spot, so to speak, that's what happens. Now, one of the things that the EBO2 will do is it stimulates a pathway. Again, I'm getting back to the pathways where we're kind of recycling that pathway. We're hitting a pathway called the NRF2 pathway, which is a major pathway in the body that reduces inflammation. And if you stimulate that pathway, you're going to have some really beneficial effects. Now, what are some of the simpler ways that people are trying to stimulate it? Well, for instance, people that take turmeric or curcumin, that's a very potent stimulator of the pathway. The only problem is it's difficult to get a good biological dose of it, unless you come here, which we have IV curcumin.
Ooh.
And not only do we have IV curcumin, and I'll get into this in a little while, we also photoactivate it ahead of time.
Oh, wow.
Amazing. Amazing. No, that's great.
So back when I had COVID, afterward, I did oxidative IV therapy. So that's just where they take one bag of blood out, they ozone it, and then you put that back in. But what you're talking about is a much more intense system, right?
Well, much more intense and really much better. Okay, so let me kind of compare the two. It's very interesting because I'm literally giving a talk at the RadFest in a couple of weeks on EBO2. I just literally sent them my talk about an hour ago because
amazing.
Okay.
Tell our listeners everything.
So anyway, what you were talking about is autohemotherapy. Okay. So autohemotherapy, they'll draw your blood out with a syringe. They'll inject it into an IV bag, typically mixed with some saline and some heparin, which is a compound that keeps your blood from clotting. And then they'll shoot ozone gas in, and then they shake it up. Here's the problems you have. First of all, you're not going to get a good interface between the ozone gas and the blood. Secondly, when you start shaking it, you're damaging a lot of the blood cells. Okay. And then you run the risk of contamination. You're taking the blood out, you're putting it in there, then you're taking it out again, putting it back. So this is one continuous loop. There's no breaks in the system. And then the amount of interaction between the blood and ozone, think about it. A dialysis filter, which we kind of revert upside down, has a tremendous surface area where you're going to have the reaction between the blood and the ozone. So it's just so much more effective. Okay. And you're only doing 200 cc. So even if you do it 10 times, you're doing 2,000. We're doing 4,000 to 5,000 cc's in 45 minutes.
Wow.
So the efficiency is just tremendously more.
Yeah. And so when I did that therapy, I had to do a Myers cocktail IV as well with it, because the doctor that I was working with said that I needed to have nutrition along with it to help the whole process along. Is that also the case? Do you have to be taking like vitamin C or, bunch of B vitamins, anything like that when you do the EB?
Absolutely not. You don't need to do those. And sometimes we don't even like to do those because, we're not sure what effect the ozone is going to have on that. We'll do it afterwards, but we don't like to do it before. Okay. So you really need to know the science because, you're all of a sudden going to maybe nullify some of the effects. You're going to have two things that are going to go after each other and going to get nothing happening.
Right. Interesting. Yeah.
So for someone with Hashimoto's that have had it a long, long time, what would you see like a protocol? Would you see coming in weekly to do this, or like have you seen?
I would recommend, I can tell you exactly what I'd recommend.
Yes.
I would recommend that you do maybe 2 EBO2s, maybe spaced a week apart. I would also recommend a V-cell, and I'd also recommend some NAD intravenously. Okay. And the NAD would be photoactivated. Now, I mentioned this earlier. We have a little machine that I have invented. It's kind of a photodynamic machine. And basically, we initially came up with this machine for our cellular therapies, be it PRP, be it bone marrow aspiration, be it fat. If somebody wanted to use, other compounds such as exosomes, they could use that also. And then one day I kind of said, I wonder what would happen. I did some deep diving. And I guess everybody's aware that intravenous NAD can give you a lot of symptoms, like you're dying almost sometimes. You get that chest discomfort, everything.
Yeah.
Well, you'll get that still when it's photoactivated. But what we find here is instead of it going up, the symptoms, it kind of goes like this, up a little bit and then down, up a little bit and down, up a little. So patients are cutting their time in half or more to get intravenous NAD. The other tricks with intravenous NAD, to take TMG, trimethylglycine, ahead of time.
Mhm.
Methylating agent, it'll make it go a lot easier. And the other thing, and I can't give you the complete science of this, is to sip on coffee. Also another thing that makes it go really well.
Well, that's easy. That's easy to do.
Yeah.
So,
Drink coffee, so when I do my NAD, I do it.
nice. So after just another question about the EBO2, what does one feel like after they do that? Is there some downtime? Are you feeling any kind of negative side effects or anything, or can you just go back into your daily life and
We typically don't put any restrictions on anyone.
okay.
We're pretty vigilant about it. And basically most people feel pretty good about it. Now, I should also mention, EBO2, not only do we do it here, but we basically teach this technique and set other doctors' techniques all over the United States, Europe, even Turkey. My nurse has been to. So I have my head nurse. She's here 3 full days a week, and then the rest of the time she's off teaching somebody. So we really have it down to a science. Interestingly enough, what we're finding on this, when it's done properly, you're stimulating two pathways. You're basically blocking mTOR, and you're really stimulating AMPK. So we're very vigilant about blood glucoses. We'll see blood glucoses drop.
Mm.
A couple of years ago, we were saying, what's going on here? And then I realized, I said, you know what, that patient's hypoglycemic. And so now we're very vigilant about checking the blood glucose a number of times while the patient's getting the procedure. And if we have to, we hit them with D50W, which is a very concentrated form of glucose that we give intravenously. And that gives us no symptoms at all.
That's amazing. Because otherwise patients will be passing out, right?
Oh, absolutely. Yeah.
Right. That's not a good thing.
Now, and if you're doing ozonation and you're not really using the proper dosage, you're not going to get that because you're not getting that stress enough.
Right.
So how do you measure the results of that then? Let's say Alex went in with Hashimoto's and she did 2 weeks of EBO2, and then what? Then do you take her blood? Do you look at her marker,
Something like that, we might look at the markers. I mean, what we're doing now is we're going to do a study to check two interesting things right away, because you literally, when you're doing this procedure, you can literally see some of the fat coming out of the blood, which is a very interesting thing. You'll literally see. So what we're going to do is we have a little meter that we can check cholesterol levels prior to doing EBO2 and right after, and then we'll probably check them a week later. The other thing that we're going to be checking on that a lot of people still aren't aware of it is how uric acid now we think is a marker of inflammation.
Yep.
We used to think, okay, uric acid, unless it was your blood value was like 7.0 or greater, not a big deal. Oh yeah, you had gout, but if it was lower than that, you're fine. Now we know that that's not the case. A lot of studies say that you need to get basically on something that can help eliminate. Actually, I think I have something here. Yeah, I don't know if you can see it. Uric acid balance. Okay.
Yep.
So I'm not the only one that said this. You have a company called Human, which is a pretty big supplement company that also is believing in this. Also,
that's amazing. Yeah.
I can tell you, and some of the products in there, make sense. Quercetin, vitamin C, tart cherry, and green tea extract, which we also have intravenously also.
Yeah, good antioxidant stuff. Yeah,
Excellent.
Cool.
Interesting about green tea.
So Dr. Purita,
I was just going to say, some of the people that may be taking the GLP-1s, to lose weight, one of the problems that you have with that is it kind of makes you lose some muscle mass. And green tea is something that we now know can help build it up. So I recommend taking that.
That's great. So when someone comes into your office, do you do an initial blood panel to get a baseline look at what you're dealing with, and then you decide which
A lot of them come to our office with blood work already done.
Okay.
I mean, I have someone here who does men's health. He'll do some of the blood testing and things, but we don't typically, we're basically here to just treat people and get them back to their other physicians and things like that. We're not running a medical practice per se. I mean, we're basically interventionalists. Maybe that's the best way to do it. Just like they have hospitalists now, we're an interventionalist.
Right. But let's say someone, when you run the blood work, like for me, let's say heavy metals and molds has played a big role, I think, as a driver of my Hashimoto. So if you don't know that, but you're basically saying we're putting you, we know you have Hashimoto's, we're putting you on the EBO2, and that will kind of solve your problem. Is that kind of how you look at it? It doesn't
That's
matter
exactly.
what
I
it
mean,
is.
for mold, we've had some very good results. I mean, I think the best way of treating or checking on mold is to do urine testing of it. The heavy metals, we're looking at that. We know that the EBO2 also helps remove that. We're looking into doing, probably going to be combining some plasmapheresis with the EBO2. What I'm really interested in is the therapeutic plasmapheresis. I think that's going to be the next big wave in regen medicine.
Can you tell us about that?
Yeah, what is that?
Sure. Okay, so basically, there's a number of studies out there now that say to really maybe move back that clock of aging or slow it down, your plasma accumulates a lot of bad things, viruses and all sorts of things. And what they recommend is that you basically maybe take out 1 liter or so of plasma and throw it away, maybe replace it with albumin. Now, we know, for instance, that there's some growth factors in the plasma that can be really not the best of things for you. TGF beta, that causes a lot of inflammation, can cause a lot of fibrosis, and that'd be something we want to get rid of. Now, to take it one step further, one of the things we're looking at doing, and that's called, by the way, therapeutic plasmapheresis, okay? So what we're looking at now is to see if we can help establish a plasma bank where it would be restricted to people 18 to 25 years old, and they would basically donate plasma, which would be given back to the patient. So it has to be matched for sex and things like that. So it'll just be plasma, nothing else. So this is something that we're looking into. There's been some pretty interesting results with that already. So stay tuned, so to speak. And we're getting close to that, but we're going to be doing plasmapheresis pretty soon.
And why that age group? Why wouldn't you take it from like younger kids? Isn't that like better plasma from younger? And
Well, I mean, I think that's going to, you may be getting too young then. I mean, I don't know if I want to start taking it from a 12-year-old. I mean, that's pretty sensible. 18 to 25-year-olds, they usually pretty much at their peak health, and they
okay.
have a lot of growth factors in their blood. They also have hormones in the blood, et cetera. So that would help also.
Okay, that's super interesting. I mean, one of the things with like stem cells that I hear a lot of people are worried about, and I guess me and my husband have been talking about it. For example, so when you give someone stem cells, but you don't give it from another person, right? You only take from your own stem cells.
Right. So here's the thing, okay? And this is one of the things that people have to realize. A lot of claims out there are that, oh, you can use umbilical or placenta stem cells because they're what we call immune privileged. Now,
Right.
they are not truly immune privileged. Those cells are what we call immune evasive. They can still be hit by the immune system, and they will be hit by the immune system. I've seen some patients who have had reactions to those cells. Now, to me, a better alternative is to do culture expansion, where what we can do is we can take some of your fat from the love handle area, send it to a laboratory in Sunrise, Florida, where they'll expand the number of cells. And they basically, fat is very rich in MSC cells, mesenchymal stem cells. And then what we can do is give you those back, and there's no real risk there at all. I mean, I do some work overseas, and I'd probably, maybe be using some of those other cells, but wouldn't be necessarily my first choice. You can get a lot of cells from yourself if need be. And, some people say, oh, yeah, but the telomeres are bad. And that's really not the case.
But it's not as the growth factors are not there, are they? I mean, the older you get, I mean, the less growth factors. Isn't that why you want to take from like a baby or the amniotic fluid?
Not really the case. Okay, so if you look at really the logistics, when you look at bone marrow, when we're young, bone marrow contains a lot of MSCs. And as we get older, it doesn't have that many MSCs, it has more HSCs, hematopoietic stem cells. So it's a numbers game. That's the real key here. It's not that fact that they're not secreting as much as we need to. It's just they can't secrete as much because it's just not a number of cells. I mean, you can have an army where you have 200,000 soldiers, or you have an army that has 50,000 soldiers. They just aren't going to do this. They may still be good fighters, but they can't do the job the same way. So that's where I think we're going to go. I think autologous cells are going to be the key in the long run.
Okay, super interesting. And what about people, like I've heard a lot of people are worried about, for example, the mRNA, or if, cancer forming, what do you say to that?
Well, now you're talking about exosomes.
Yeah, even exosomes, or if you've taken it from another person, not yourself,
But
let's
it's
say.
also the good and bad and the ugly in the exosome. The problem we have, exosomes are kind of like noise. It's not
Right,
music, it's noise. It is good.
right,
and bad. So we don't know what's good, what's truly in there. I mean, you have exosomes, they can have some oncogene stimulators, which basically are cancers and things like that. You also have other good things too. So don't get me wrong. I mean, I just don't know what the true answer is. I think we have to be able to delineate a little better what's in the exosome mix right now.
right, right.
That's
Yes,
why I think if you take your plasma from an 18 to 25-year-old, by and large, you're going to get mainly good exosomes.
right, right. Okay, yeah. I
No
mean,
old exosomes.
yeah, yeah, exactly. We're all like,
We don't know. I mean,
yeah,
and the other thing, I hear crazy people, they say, oh, I gave, 10 trillion exosomes. What does that mean? I have no idea. To tell me, does that mean it's a lot? Is it a little? I don't know. And how effective are they? I mean, we still have a lot to learn. I think
yeah.
exosomes are going to be something important, but we need to learn more about it. That's one of the reasons I think why the FDA is not too keen on the use of exosomes intravenously and things like that.
Mhm.
Super interesting. Um, let's move over to all the biohacking equipment and the different stacks that you have on offer at PUR-FORM. It's,
Okay.
as I said, it's a candy land, and go through why you have the different equipment and kind of how you're stacking it.
Okay, so one of the things we have that a lot of places have is we have a hyperbaric chamber. Okay, it's a hard shell, so knock on wood. Now, one of the things I don't have is I don't have it with pure oxygen. You breathe in pure oxygen, but the environment is compressed air, much safer, because with pure oxygen, you run a fire hazard risk. Women have to take all their makeup off, can't wear any perfume. Most of the clothes have to come off. You can't bring your cell phone. So this does the same thing, because remember now, you don't absorb oxygen through your skin. You still have to absorb it through your mouth. Okay. And then what happens is, as it gets into your system, it then dissolves in the plasma, the watery part of the blood, because your hemoglobin is saturated. It can't take any more oxygen, period. So that's how you get more oxygen into the system. But this is now one of the things that you have to realize. We have some tricks here. What we like to do before someone does hyperbaric oxygen, and this is another stack that we have, so to speak, is we give them hydrogen gas to breathe. Why do we like to give them hydrogen gas? Because hydrogen is one of the most potent antioxidants, anti-inflammatories known to man, and it gets everywhere, including the blood-brain barrier, et cetera. So when you do hyperbaric oxygen, it's oxygen. It's creating some oxidative stress, not necessarily something we really want to do too much in some of these people. So the hydrogen will kind of nullify that effect. The other big effect in using hyperbaric oxygen, we give something called Neo40, which is a nitric oxide stimulator. Why do we like to do that? Well, a very important reason is, and this is from the work of Dr. Tom at the University of Pennsylvania, who really did the classic study on hyperbaric oxygen. What Dr. Tom really showed us is, yes, the oxygen is important, but when all is said and done, the real benefits of hyperbaric oxygen, over 20 sessions, it'll increase the stem cell output from your bone marrow by 8 times. That's the key. Remember, cells, not doctors, heal the patients, and it's a numbers game. So that's where it's a twofold thing. Most people, yeah, okay, it's the oxygen, that's great, but it's also the stem cells, because that's what's really going to get you to heal. You have a diabetic who has a foot wound, unless he can give him all the oxygen in the world, but unless he has stem cells to heal that wound, he's not going to heal it. So that's what I like about that. So the two little things that we add on to that hyperbaric is, we'll give them hydrogen gas, and we'll give them Neo40, which is a potent nitric oxide stimulator. Okay, so that's number one.
I love the sign that's coming up.
Okay,
The
so
thumbs up on your screen.
Yeah, I think that comes up sometimes when you say something like, or you do a thumbs up or a positive. Or
I love that. I've never seen that. That's great. I love
yeah,
it.
Zoom has funny little
Very
symbols.
high tech. Sorry.
another thing we do, one of my favorite things to do in this office is intermittent hypoxia therapy, okay? Oh, the other thing I should mention in our, with our hyperbaric is sometimes when people just want to do it for general well-being and maybe anti-aging, we'll have them do what we call air breaks. In other words, for every 15 minutes that they're using the mask, we have them take it off for 5 minutes. That's from the Israeli study where they basically said, hey, we're doing this, and what we're getting is we're basically diminishing immune senescence. What does that mean in English? It means that our immune system, it was kind of getting older, we're making it younger. Remember now, your immune system really controls your health when all is said and done, because that's what really goes after these bad things and gets them better. So that's another thing that we do. All right, so another thing I like to do is intermittent hypoxia therapy. Now, not many places have that. Now, this is a very simple modality to do. You're sitting in a chair, relaxing, looking at your iPad, your phone or something, and you're breathing in a mask, and the level of oxygen goes from 9% to up to 40%. So it's bopping that level around, but it's almost like training at altitude. Now, this is an extremely potent stimulator of your mitochondria. And I think most everything I do here, when all is said and done, it's really boiling down to the health of the mitochondria, and I'm trying to stimulate them and get their health. So that's another thing that we do, and it's a very good thing to do, and it has a lot of benefits. Again, we're going to basically get rid of some immune senescence and things like that. So another good thing I like to do. Another thing that we're doing is whole body cryotherapy, 3 minutes, 200 degrees below zero. I think it has some very good benefits to it. We also do infrared and red light saunas and cold plunge pools. Now, what do these things do? Well, yeah, everybody says, yeah, they're good for you, but why are they good for you? Well, yes, they help reduce inflammation, but there's a very important aspect to these things. They basically create something called heat and cold shock proteins. And to let you know how important these things are, I'm giving a main stage lecture at RadFest on that. So I'm giving 2 lectures, one on EBO2, but main stage is heat and cold shock proteins. These proteins control how your proteins fold into your cells. What do misfolded proteins result in? Neurodegenerative diseases like Alzheimer's, Parkinson's, etc. What else does it do? Well, you know what? When your receptors on your cells, when the protein didn't fold properly on those, guess what? You're going to be getting diabetes and things like that. Also helps do autoimmune conditions. So these are exceptionally important, okay? And then we have some, little tricks that we're going to do with that. We have some medication. I just got it from Japan. I can show you the box. You're not going to be able to read much about it, but there's the box.
Oh, wow.
This is a medication from Japan, and basically I believe it's an ulcer medicine, but it seems to be a very potent stimulator of heat shock 90, I think it is.
Oh, wow. And you can only get it from Japan?
I beg your pardon?
You can only get it from Japan, or is it special strength? Or
I know you can get it from Japan. I was able to get it pretty easy. I just ordered it online. It was like $28 or something. So when you're going to do a sauna, this would be something good to take. Now, the only thing that you got to be a little careful about is if you have a cancer, maybe that's not a good thing, because, heat shock proteins help cancers survive. So you got to be a little careful about it. The other thing about heat shock proteins, they also can have a profound effect on our telomeres in a very positive way. They can, basically make that telomere not get so short. So if you want, you can always look online and you can see my lecture from RadFest. I'm sure we'll on our.
I love that. So, Dr. Purita, there's a company called Eng3. Have you ever heard of them? Eng3. Eng3, ENG3, and they're basically, they are supposed to help with misfolded proteins. And it's like a device that it sends out this water. It's quite famous in the biohacking world. A lot of people are using it. Molly and I have tried it. I don't know if we can really.
What's the science? I don't know. Tell me.
I have to send it through you because we have tried it, Molly. Do you remember what I'm talking about? Where you're sitting and it's just like, it looks like a microphone and it has like a misted water coming out.
Oh, yeah.
It's Eng3 is the company. I'll send it to you.
Send it to me, but I mean, I know this subject pretty well, and I don't know how that's going to stimulate heat shock proteins. I mean, you basically have, you know, the real name for these things should not be heat and cold shock proteins. They should be stress shock proteins, because that's how they get stimulated, by a stress.
Nano V. Nano V. Have you heard of that?
Nano,
Nano V.
let's see.
Have you seen that?
I can't quite see it. Put it a little lower.
This is the machine. It looks like that.
I don't know. I mean, you know, look, I always have, at least, I'm always willing to listen to something, but you got to
Yeah.
give me science. I mean, you can't
Yeah.
just give me some.
I'm gonna send it to you. I know a lot of biohacking labs that love it and they are swear by it, but it basically targets protein folding, and it's unique and effective way to promote well-being, performance, blah blah, because it actually it helps with the misfolded proteins.
Well, the only thing that's going to help with misfolded proteins is going to be the heat shock proteins, cold shock proteins. They're like basically, consider them like helicopter parents. They hover over that protein and get it. And if the protein is just too far gone,
yeah,
then it's going to basically get rid of it. You know, the heat and cold shock proteins are intimately related to the P53 gene. Are you guys familiar with that?
No.
P53, a very important thing. It's called a tumor suppressor gene.
Ooh.
And basically, many of the cancers that we get are because we have a mutation of this gene. Now, to give you a good example of how important this gene is, think of an elephant, one of the largest mammals we know of, and the incidence of cancer, even though it has billions of cells, is very low. Why? Because an elephant has multiple copies of the P53 gene. Many of the pathways are really intimately involved with this P53 gene. P53 basically does an analysis of the cells. And it says, your DNA is damaged, but I think I can fix it, and it fixes it up. Yeah, your DNA is damaged too much. You're going to apoptosis and things like that. So basically, it's when those cells accumulate, and that's another thing we can talk about, senescent cells.
Yes.
That's where the problem is. I'm giving a talk on senescent cells, I think, in a week or so by Zoom, luckily, in Brazil.
Amazing. And that's, I mean, the first thing that comes to mind is intermittent fasting, right?
Among other things, yeah.
Yeah. What else? What else do you recommend for that?
For senescent cells?
Yes.
Okay, well, you can do the very classic way of getting rid of them. First of all, you need some senescent cells.
Yep.
Without senescent cells, your body really is not able to heal things. So some of them are important, but you know, for those that don't know, a senescent cell is sort of like a zombie cell, a cell that should have died, but it continues to live. Its cell cycle is it won't reproduce, but it's like a zombie in that it'll start infecting other cells and cause them to not work well. So a couple of different ways you can go. We know some simple, common, easy things to do senescent cells are basically quercetin, which is a very good over-the-counter supplement. Now, there's actually a supplement I designed for a company called UltraCure. It's called Synultra. It's a combination of fisetin and a couple of other things. But one of the classic things out there is quercetin and dasatinib. Dasatinib is a leukemia medicine that's used off-label. And this basically was a study performed by, I believe, Wake Forest University and University of Texas, and they had some pretty dramatic results. And it's a very simple thing. You take it 1 week, and then you take it like a week later. It's based on your weight. I'll be honest with you, the medicine is too expensive here in the United States, so we ordered it from India, and it was much more reasonable. And we just give it to the patients. Now, another thing that everybody out there needs to realize, when you start taking intravenous NAD and some of these other supplements, remember now, you're also making these senescent cells a little healthier. So you need to address them. That's why when we do an NAD, we give the patient some quercetin afterwards. Very important aspect. So you're kind of making these terrorists healthier. You don't want to do that. You want to kind of, make them
right. So what about, do you put all patients on this quercetin with the statinib?
Sometimes I just say you can take the other stuff. I mean, I think the other supplement's something like $30 or $40. The dasatinib is it's not that expensive either. Maybe like a little more, maybe $100 altogether. But remember now, that's for 6 months.
But shouldn't everyone be doing that? I mean,
I think most people should be doing it. Yeah.
Right.
I was doing it a lot, and then I stopped doing it when COVID came along. You might say, why? Because when you take the dasatinib for like 24 hours, you feel like you're coming down with the flu. I mean, remember now, it's a chemotherapy. It's a leukemia drug. But usually after 24 hours it passed. So I said, well, I don't want people to think they're coming down with COVID. So, but now I'm starting to use it more and more again.
And again, how often would you do it? Like for 6 months, but how often? Once every.
Oh, you do it like you do it 1 week and then you do it the following week and then that's it. That's the regimen. It's a very simple, easy thing to do. Occasionally, I still would recommend taking some of the weaker senolytic agents. Okay, you know, there's a whole host of them out there.
Yeah, exactly. Well, that's amazing. Okay. What about like, would you go and run like these we had on our podcast a couple of weeks ago, cancer check labs, who checks for 200 different, circulating tumor cells? Would you go and check everyone for that before you start any type of regimen or protocol?
No, again, you know, the senescent cells are basically not cancer per se. I mean, you can do certain testing to see how many you have, but how accurate that is, it's hard to say. But remember now, they can start secreting certain growth factors that are going to not be beneficial for you. They're inflammatory growth factors. Remember, they cause inflammation, inflammaging, inflammation, aging, and inflammation, is the root cause of a lot of bad diseases.
Right. No, exactly. I was just thinking before people go and do like have the heat shock proteins, and that can, if you have already growing, let's say, tumors, that can exaggerate it.
I mean, I'm a little more of a practical person about it. I mean, if you have a history of a breast cancer or something like that, yeah, maybe that's, or prostate, maybe no. I mean, if you have no history of cancer, I'm not too concerned about it as far as the heat shock. I mean, it's not going to be like they're going to make that cancer grow when it normally wouldn't grow. But I mean, if you have an active cancer, you don't want to do it. Okay. But other than that, I'm not too concerned.
Yeah. Do you have some examples of some success stories that you've seen in your clinic?
As far as what, one specific type of treatment, or I mean, lots of them. I mean, a lot of athletes that we've treated for, various injuries. We've seen high numbers of patients with autoimmune conditions for EBO2, for mold, things like that, autoimmune conditions. I mean, again, it just goes on and on. I have to say, at least anecdotally, that's what I tell these people, because I don't need to get involved with the FDA and the FTC. So I say, well, anecdotally it works, but we know it works.
Yeah. That's great. So people are feeling good when they leave. They're ready to roll.
Not necessarily right away. Remember, sometimes it's like renovating a house. You don't renovate a house overnight.
It's true.
Sometimes it takes you.
Exactly.
Yeah. 6 months, a year. Sometimes
No, that's too much. No, we're talking, a couple of weeks, a number of weeks to see.
Good. Okay. Oh, that's pretty quick, actually. Yeah, I would say that's pretty fast.
Look, everyone's different, but we like to see some results within a few weeks here and there.
Okay, great.
Dr. Purita, what does a day in your life look like? Can you kind of tell the listener, give us some little secrets and hacks, what they should all be doing?
My day is I get up around 4 o'clock in the morning.
Whoa.
These 4 o'clockers.
Okay. No, thank you. Okay.
We just interviewed someone else who also gets
regimen when it comes in the morning. So 4:45, I'm leaving my house, going walking for about an hour and 10 minutes for about 4 miles.
Yeah. But it's dark. You walk in the darkness? Oh, you don't care?
No, I mean, well, I walk around my neighborhood. I mean, there's street lights. It's okay. And there's sidewalks. I'm pretty.
Okay.
And if it's raining, I still go out, 7 days a week.
Like that.
Then I go back and I do my elliptical and I watch TV while I'm doing my elliptical for about 25, 30 minutes, get my heart rate up to 150. I'm approaching 6,000 miles on my elliptical. Wow. And I haven't for 20 years. Okay. So, and then I go and swim for about 20 minutes, 25, and then I get to the office. That exercise regimen is 7 days a week. There's no rest for the weary.
Wow. Good for you.
Good for you. That's impressive. And then, the intake of the food, like what do you eat? What supplements do you take? I mean, what biohacks do you do? What do you stack?
What do I eat? I mean, I'll eat, listen, I'm Italian, so I'll eat a lot of things that, I'm not I'll cheat. I'll have a little ice cream here and there, but I do intermittent fasting during the week, 18 hours.
18. Wow.
That's
very regimented about that. I mean, 18
Wow.
hours and I'll do it. But then when I go home, I'll eat, and I'm not really going to worry too much about what I eat. And then I'll stop around 8 o'clock, 9 o'clock, and then that's it. I won't have anything, and that'll be it. I mean, I may get, maybe I get a little calories from my fish oil. So what do I take now? So I take fish oil, among other things. Take about 3,000 a day of the EPA, DHA, put the fish oil in the freezer, you get better absorption and it won't burp up and give you that fishy taste.
Mm-hmm.
What else do I take? Well, I take an NAD precursor, NR. I take, one of my really go-to things is urolithin A. Are you guys familiar with that?
I am, yes.
Urolithin A is it kind of comes from, I think, pomegranate and things like that, but you can't just get it from taking pomegranate because it has to be processed by your bacteria, which most of us can't do. But urolithin A is a very potent stimulator of mitophagy and mitogenesis. Again, mitochondria are the real kings of your health. So I take that. I take trimethylglycine to keep my homocysteine levels down.
Yeah.
I take, one of my other go-to things is berberine. I think it's very important. Now, it's interesting. I just wrote an article comparing berberine to metformin. Metformin is very common diabetes medicine, and I was taking it one time a while ago for mainly anti-aging, anti-cancer, no diabetes as far as I know. And I think berberine works better because metformin has a tendency, and even Dr. Sinclair has admitted to this, that it can sometimes nullify some of the effects of exercise. We don't think that berberine does that. Okay. One of the problems we had with berberine until recently is that it would give many patients some GI upset, diarrhea or something like that. But now with the phytosomal version, doesn't seem to be the problem anymore. Let's see what else I take. Green tea extract, very important. I take something called Sinsulin, which is a combination of cinnamon and chromium. Again, trying to keep my AMPK, get my glucose down and keep it down. NAC, I take some alpha lipoic acid, things like that. So occasionally I do some IVs, but IV is mainly just some NAD occasionally.
And do you have any favorite kind of brands that you go with usually, or do you
I
kind
do.
of match? Yeah, tell me.
One of the brands that I use a lot is the brands from Human, HUMANN. I'm actually on their scientific board.
Oh.
And once in a while, if you see a commercial on TV for Super Beats, I'm in their commercial. But I'm going to be honest.
He's a movie
At this
star.
stage in my life, unless I thought the product was worthwhile, I wouldn't, be in anything promoting it. And look, I take it myself, so that should tell you something. So another company I like to take is Thorne Research. I think they're very good. So I use a lot of their products also. And then another company I like, it's an up-and-coming company, is Codage, CODE.
Guys.
I like them for their urolithin A product. I mean, urolithin A is something that I think everyone needs to take. It's that important. I mean, you don't want to sacrifice your mitochondria. This really helps preserve them and makes new ones.
So I am super passionate about red light and red light therapy because I use a red light bed at least 3 to 4 days a week. And that helped me tremendously with how I sleep, how I feel. I mean, my energy is just like off the rocker from the red bed. So can you kind of talk about that? What do you think about it?
Sure. I can talk about it a lot. So basically red light, usually anywhere from what we call 660 or 630 to 660 nanometers. And even in the near infrared, what does it really do? Well, it stimulates something in our body called the electron transport chain. More specifically, it stimulates something called cytochrome C oxidase. And that basically, when you stimulate this electron transport chain, what are you really doing? You're making more ATP, which is the body's energy currency. So that's why all my biologics get photoactivated prior to getting injected into the patient. And we have a red light bed here. We have it's red and infrared actually. So it's very good. And it just so many health benefits.
Yeah. It's my favorite biohack. It's by far my favorite biohack. And I do a lot of different things. I love it.
There's no question. And it's easy to do. That's the nice thing about it too. Easy to do. It's relaxing. I mean, it's a great thing.
I love it. What about, we see some green plants there behind you. Do you have a green thumb? Do you
I
like
do,
your
as a matter of
gardening?
fact, it's a hobby of mine. I used to go with a friend of mine years ago. He owned a big nursery, and we used to go to Asia to collect various exotic trees. So I have some exotic stuff in my house. I have some breadfruit. I have some jackfruit. I have some durian,
Oh,
which is
yes, the stinky one.
a stinky one, but to me, the best of the fruits. They taste the best. So it's always like in the weekends, I'll be, working in my garden. It's my hobby and my passion. And I like it. It's a lot of fun.
I love it. It's obviously therapeutic and great for your mind as well, right?
The plants in here, well, they'll hopefully, they can see a couple of them there. They'll
Yeah.
get my environment a little better, and it, kind of keeps me even keeled and things like that.
Oh, are you an earth sign in astrology? Sometimes people who like plants are
Sign, no, I'm a Piscean, so I guess I'm
Virgos. Oh, you're water. Okay.
Piscean
Oh, yeah.
water.
So, Dr. Purita, what's the next step for you and for your clinic? And where do you see kind of the future heading in the whole longevity regenerative space?
I think, little by little, it's going to be overtaking mainstream medicine. They're kind of living, they're like on a piece of ice, and the ice is getting smaller and smaller.
Yep.
They have to either basically resolve themselves to do this or be left behind. People aren't stupid. People realize, wait a minute, that's old-fashioned stuff. I don't want to see that guy.
Yep.
Yeah, there's a lot, that's the other thing. In this field, I'm an orthopedic surgeon by training, as we said.
Mhm.
Now, in orthopedics, there's no way in this world most orthopedics are ever going to make a big difference in anything. What it is, okay, you can maybe change the prosthesis a little bit or this, that. But in regenerative medicine, a lot of things that you can do. I mean, to me, I came up with this new technique. I call it EPAT, extracorporeal photoactivation therapy, that we're doing now with NAD. We're doing a curcumin with methylene blue, where we're basically photoactivating them prior to even putting them in an IV bag. That's something unique that I can say, okay, I made a little mark on something, whereas these, in the other fields, I'm not going to do anything. So you can make a mark in this field if you put your mind to it and really think about it.
I love it. But where do you think the space is heading in the next 10 years? What do you see in this kind of your realm of work? Like
We're
these stem
basically
cells?
improving exponentially. We're being accepted by the masses.
Mm-hmm.
I
Mm-hmm.
think we're going to see longevity really taking a front seat. I think 80 is going to be the new 55,
Wow.
60. Okay. And I think it's very, very realistic.
I agree with you. Absolutely.
Yeah.
How young is your biological age?
Well, I've done a couple of tests. Okay. So I did an intracellular NAD level. And, there's one of the biohackers on there who's the, multi-millionaire who's spending $2 million a year.
Brian Johnson.
So his level was 54. And he said, wow, that's great. I'm that of a 16-year-old. I said, well, that's pretty good. I put on LinkedIn, except my level was 55.
Oh.
Oh.
I was going to be involved in another test where I was going to basically use a suit that was electrified to see if I could increase my protein. But they said, you got to send your blood off for an analysis. So I had my head nurse do it, and I said, all right. So we sent it off to some lab in California, and I got my results back. And I looked at it, and I said, oh, okay, I'm in the 90th percentile. But that was the 90th percentile of the 18 to 35-year-olds.
Oh.
I guess I'm not going to do this electrical suit either. So, look, here's the take though on that. When all said and done, I just put something on LinkedIn, I think today. It's a mosaic, your biological aging. I mean, when these people go, well, I'm really, I'm 65, but I'm really, 45. Wait a minute, you can use some biomarkers that are going to show your age, and you're going to have other biomarkers that are going to be young. It's a mosaic, but look, if it's a mosaic and the more you have in that mosaic that are younger, the better, I think. But we still have to figure out what it really means.
Yeah, of course. And what about your Italian heritage? Like, what are you adopting from that kind of the lifestyle hacks? Because we think of Italians being, eating all this great food and laughing and living till their old age and, community and all that. Are you implementing all that in your lifestyle? Like,
I try to, listen, I'm a first generation Italian American. And I was brought up with a lot of the old customs, so to speak. Now, a real interesting thing here. So here's one of my little customs here. So I used to see these old guys, this is like in the 1950s. These guys were living into their 80s. Here's a little olive oil here, okay?
Here's this little olive oil. I love it.
But let me
That
tell you
for
why I'm
lunch.
doing that, okay? And look at what this is here. Resveratrol, okay?
Oh, yes. The
Mhm.
great.
Now we have intravenous resveratrol here, among other things.
cool.
I told we have some
Nice.
great things. But the problem with resveratrol is its bioavailability,
Mhm.
except it's fat soluble.
Right.
Ah, so you
So
take.
I get my olive oil, a tablespoon mixed in the
Oh, nice.
resveratrol, and lo and behold, a 1-2 punch, taking some olive oil, which is good for my health, and I'm
course.
going to get better bioavailability because of the fact that it's now dissolved in the fat.
Love it. I
Okay.
love it. Talking about olive oil, which ones do you recommend? Because this country's dodgy with its olive oils. I mean, they
The problem we're having here, unfortunately, the mafia in Italy is diluting it all,
Yeah.
and you don't know what you're getting. So I don't
Exactly.
know. I mean, I'm going to be honest with you. I buy it from Costco. I figured, you know what? They're probably, but it's extra virgin, first
Yeah.
press, full press. Okay.
But you trust them. I see. I don't trust that. But hey, it's a
I
little.
don't know. I don't know. I mean, I buy in some of the Italian shops, but I don't know. I wish I knew really where I could get good olive oil.
Yeah. Yeah. Exactly.
Stephen Gundry, Dr. Stephen Gundry has his own brand of olive oil that's extremely expensive, but I'm sure that one's good. He sources it.
The question is, where are they really getting it from? I mean, that's the problem. Unless you can actually go to the farm and you get it there. I just don't know.
No, exactly. Exactly. We have no idea.
I love olive oil though. It tastes so good on everything.
Olive oil is
So
great,
Oh, it's
I mean,
so good.
I go and I'll cheat once in a while and have some bread in a restaurant or something and say, how about some olive oil? I don't want this butter.
Exactly.
Exactly.
Do you ever go to Arthur Avenue in New York?
No, I haven't been there.
Oh, you haven't been there. Oh my God. That's like our New York friends. Like they go every week and buy all their supplies there.
What was that, in Little Italy?
Arthur Avenue is in the Bronx. Yes. And it's like the best. I'm just thinking of this because I saw a photo from like 8 years ago and we were there with our kids. And my son, who is now 14, said, "Oh, Mom, those were the best short ribs I've ever had in a restaurant called Enzo's, which is a very famous Italian
I've
restaurant."
heard that. Remember now, I grew up on Long Island, so I mean, I kind of knew these places, but
Yeah, no, it's kind of the Arthur Avenue is like a big food,
I think I've heard of it now, come to think of it.
Yeah. So anyways, Molly, do you have any other questions for Dr. Purita?
Well, I was just curious, like from the people who are going to be listening to this would be potential like clients or potential patients. So what would it look like? So do they just call you, make an appointment, then they come in and you tell them what you think is the best set of stacks for them?
Look,
How does
we
that
do
work?
consults on the phone, we do consults occasionally like Zoom and, live consults. And the interesting thing is, our consults are complimentary, which is
Oh,
kind of nice.
great. Okay,
You're
great.
not spending a ton of money. I mean, usually they can, the best thing to do is to call ahead of time. And
Yeah.
I have one of my patient coordinators, he'll kind of, talk to the people, and then I may talk to them on the phone. If they're local, a lot of times I like to see them in person.
Yeah.
But we treat patients from all over the United States, and occasionally from other countries, and things
Yeah.
like that.
And you also do HRT therapy, right? I saw some
I have
testosterone.
a gentleman here who does basically men's health. He's going to be starting to do some women's health too, but I can only do so much. And,
Yeah.
and I have to be honest with you, I'm more interested in the, anti-aging cellular therapies and things like that. That's what turns me. I mean, the other stuff is great and it's very helpful but I can only do so many things. So I have Thomas do it, and Thomas does a great job at it.
Yeah. So you have people that are doing all sorts of things. So
Yeah.
it's like really a very, eclectic clinic. You can get all kinds of things done. And you guys do GLP-1s too.
Oh, yeah, very
Think
much
about
so.
those. I'm kind of curious about your thoughts about those.
Oh, you can, my thoughts are, it seems to help a lot of patients.
Mhm.
Oh, I mean, you have to be realistic about things. You can say, oh, it has this side effect, that, yeah, but when all is said and done, probably one of the most important things is to lose that weight, okay?
Yeah. Yeah.
Because, what people don't realize is fat, it contains a lot of inflammatory cells.
Mhm.
Uh, and it contains inflammatory stem cells and other cells. So it can make a big difference in your overall health to get rid of some of that. Yes, there's some people that are going to have side effects. And if you go online, you can see some of the blogs I've written recently on how you can basically, circumnavigate some of the muscle losses that you're going to have. And also I've designed some programs for people that basically are not having success with the GLP-1s.
Mhm.
Hypoxia. It's a very potent stimulator of losing weight, and people that have gone skiing, they realize when they first go to a high altitude, they say, I kind of lost my appetite for a couple of days. The
Yeah.
hypoxia does that, okay?
Right.
Another thing that does it is whole body cryotherapy. That can burn a couple hundred calories in a 3-minute session.
Yeah.
Things like NAD, we know can help you lose some weight and things like that. So there's a lot of stacks, as you say, that we can put together and we can tailor it to the patient.
That's wonderful.
Yeah.
Actually, I have a friend, or my husband's brother. He's got a type 1 diabetes. He doesn't even have a pancreas. Okay, he can't be on the GLP-1.
Wow.
Is what I've heard. So what can he do, because he's larger and he wants to lose weight? Can
Well,
he do other alternative things you were
do
just
is,
saying?
I tell you what, we can send him, just try and call the office tomorrow and we can send him the blog. I just wrote about that on people that aren't successful with the GLP-1s. How can we do it? Green tea extract, things like that can help. Whole body cryotherapy, intermittent hypoxia, things like that. I have a whole program that I just designed recently about
That's
it.
amazing. Okay, that's amazing.
Mhm.
Yeah, that would be really interesting. No, I love that. So Dr. Purita, where can people find you?
Where can they find me? In my garden.
Yeah. Specifically.
Of course.
Find me in Boca Raton. We're called PUR-FORM, and we're in the research park at FAU, which is kind of nice. It's mainly scientific here, and that's a good thing. But our address is 3600 FAU Boulevard, Boca Raton, Florida.
And so
Wonderful.
people know it's the most beautiful place. It's so, your branding is beautiful, like it looks like a spa. So like when you go, you'll be very impressed.
Who
Beautiful.
did that? Was that your design, Dr. Purita, or did you
Well,
have
that was our general manager, Miss Nicole.
Mhm.
Yeah, I met her.
She did a great job. She really oversaw it, and she's totally dedicated to this facility and its well-being, so to speak.
That's wonderful.
That's great. It shows.
Yeah, it shows. Absolutely.
Very much.
This is great.
Yeah.
Thank you
And
so
follow
much.
him on Instagram too, the PUR-FORM, because that's it's got a lot of great data, a lot of great videos on all of the things that you offer. So
Yeah, we try and do 30-minute, and sometimes it should be 30-minute, 30-second stuff, and that's the hard part.
Yeah.
When you have
Yeah.
to do something, you have to kind of make a point, but you have, just like when I'm doing these talks. I mean, one talk is 20 minutes, one talk is 25. I mean, I could talk 2 hours on these subjects, but I got to
Right.
say, what can I get rid of, and you got to tailor it to the audience somewhat too. I said, well, they're not going to care about that. Throw it away.
Right.
Yeah.
And also your website has a lot of great blogs. That's
Most
another.
of the blogs I write myself. I mean, I pride myself. And if you really want to do things, go on LinkedIn, because LinkedIn's where I put a lot of the real science things.
Oh, fun.
Things that I think are probably not, a little more esoteric for my office. I mean, I think I put 3 or 4 things on today on LinkedIn. I usually kind of give a little synopsis of the article and put it on LinkedIn. So I have a lot of followers on LinkedIn. That's something I think that if people are really interested in it, follow it, because I give you a kind of an explanation, excuse me, that is not, totally ridiculous. You can kind of get the gist of it, so to speak.
Now we understand why you're up at 4 a.m. I get it now.
That's why he's going to live forever. It's those 4 a.m. walks.
How many more years are you going to be working?
I don't know. I'm kind of maybe the old Italian persuasion that working keeps you young.
Yes.
And I got to it.
Mhm.
Oh, when my parents stopped working, that's when their health went south, like within a year. like
You know,
that.
to me, this is not work. This is fun. This is interesting. It's
Yeah.
entertaining.
You're
thing.
helping people. You're helping people.
Helping people. So
Yeah.
why would I stop right now? I mean,
I
you know,
love
if
that.
I feel I've kind of lost some of my skills, then it's time to go.
Yeah. Hopefully not in many, many years.
I hope
Like
not.
50 years or so.
Then he'll
Uh,
start like some fancy garden somewhere where people can go and be meditate. Do morning walks and meditate there.
I love it. Dr. Purita, this was a treasure and a pleasure to have you on our podcast, and the listeners are going to love to hear all your tips and hacks and everything
It's
you
been a
have.
pleasure, and boy, the time just zoomed by. Wow, I didn't even realize the time already. Boy,
I know,
know.
it's crazy.
It's wild.
Time for dinner, or I don't know what you're up to this
actually
evening.
going out to dinner for some Italian food with my wife.
I love it. Have a wonderful weekend, and thank you so much
guys.
for your time.
It's been my pleasure. Thank
Dr.
you.
Purita.
Thank you.
Thanks.
Bye now.
Bye. Bye.